Hi, this is Samna, optometrist from Global College of Allied Health. Today the topic is retinal vascular disorders. First one is central serous retinopathy, CSR. This is the picture, OCT picture showing central serous retinopathy. Definition. Central serous retinopathy is characterized by sudden edema of the macular area. Typically, it affects the young adult males due to unknown case. It is basically a localized retinal detachment and caused by exudation from the parafoveal of choroidal capillaries. Symptoms includes sudden onset of blurring of vision in one eye, black fixed spot at the center of the visual field, metamorphopsia. Signs. Visual acuity is reduced to 6 by 9 to 6 by 18 and often it is correctable up to 6 by 6 with the plus lenses. This is due to the elevation of the neurosensory retina which produce acute hypermetropia. The ophthalmoscopically, the macula appears as oval or circular dark swelling. It is about the size of the optic disc which is surrounded by the glistering ring reflex. Findings of fundus fluorescent angiography. There are two patterns seen in FFA, smoke stack patterns and ink blot patterns. Smoke stack patterns, there is a small hyperfluorescent spot which ascends vertically like a smokestack and gradually spread laterally, taking a mushroom or umbrella configuration. The second is ink blot patterns. A small hyperfluorescent spot gradually increases in size. Prognosis. 80 to 90% of the cases of CSR undergo spontaneous resolution and the visual acuity returns to normal or near normal within 4 to 12 weeks. Mild metamorphopsia or micropsia may persist for a long period. 40% of the patients developed recurrent attacks. Treatment. Majority of the treatment is required except reassurance. Organ laser, double laser, YAG laser should be given. If the CSR is recurrent with the visual loss, vision in the fellow eye is permanently reduced to previous attacks of CSR if the duration is more than 4 months in presence of turbid subretinal fluid. Next is the cystoid macular edema. This is an OCT picture of CME. Definition. Cystoid macular edema is an accumulation of the fluid in the outer plexiform layer and inner nuclear layer of the retina in the macular region. Etiology, Ewing gas syndrome, diabetic retinopathy, retinal vein occlusion, that is CRVO or BRVO, pars planatus and iridocyclitis, RP, epinephrine. Aphakic eyes, the treated with epinephrine for open angle glaucoma should develop CME. Treatment, NSAID, vitrectomy. The next one is CRAO, central retinal artery occlusion. This is a fundus picture showing CRAO. Definition. It includes interruption of the blood flow through the central retinal artery by the thromboembolism or vasospasms with or without retinal ischemia. Etiology, emboli from the carotid artery, valvular heart diseases, thrombus from the arteriosclerosis, hypertension, arteriitis. Symptoms include painless unilateral loss of visions, amaurosis fugax, which is a transient loss of visions for few minutes due to the minute emboli blockage, which will be a premonitory symptoms. Signs include which large arteries are become thread-like and smaller arterioles are totally invisible. Veins are almost normal. Within a few hours, retinal losses is transparent and become opaque, that is milky white color. A day or 2 days later, a cherry red spot appears at the fovea. Vision is reduced to up to no PL and there is no direct pupillary reaction. Treatment includes immediate, intermediate digital massage to the globe, intravenous acetozolamide, paracentesis of the anterior chamber, retrobulbar injection of acetylcholine may produce vasodilatation. Anticoagulants as intravenous heparin. The next, this is a CRVO, central retinal vein occlusion. This is a fundus picture showing central retinal venous occlusion. Bleeding in the retina in all the four corners, nerve is swollen, vein is swollen. This picture, fundus picture, shows central retinal vein occlusion. This is another fundus picture of CRVO. Hemorrhages are visible in this picture. See. Definition: CRVO may involve immediate loss of vision, maybe, or it causes a partial loss of vision. Predisposing factors include 6th and 7th decades, hypertension, raised IOP, diabetes, hyperviscosity syndrome, periphlebitis. Types of CRVO. Two main types, non-ischemic and ischemic. Non-ischemic is a partial CRVO. Ischemic is a complete CRVO. Non-ischemic, the clinical features are visual acuity is slightly or moderately reduced. RAPD is present. Ophthalmoscopic view shows mild tartaricity and dilatation of the all branches of the retinal vein. Central retinal vein, dot and blot and flame-shaped hemorrhages are seen throughout all the four quadrants of the retina. Cotton wool exudates are visually absent, mild to moderate swelling of the optic disc. Macular edema may or may not be present. Prognosis: 30% of the cases, the retinopathy resolves and the visual acuity returns to normal or near normal. Permanent impairment of vision is due to chronic macular edema. Treatment: no specific treatment is required except to treat the predisposing factors, if any. Next one is ischemic CRVO. Clinical features include marked reduction in visual acuity. RAPD is also marked. Ophthalmoscopic view shows marked engorgement of the retinal veins, massive superficial and deep hemorrhages throughout the fundus. Cotton wool exudates are common. Optic disc is swollen and hyperemic. Macular edema and hemorrhages are present. Treatment: panretinal photocoagulation.